Good afternoon, Senator Murdoch. My name is Whitney Walker, and I am a constituent of yours. I am a registered nurse for Wake Med Hospital. I have been a nurse for over 7 years and worked tirelessly at the bedside caring for the sick. I would like to talk with you about the SAVE Act and the importance of nurse practitioners working independently to the full extent of their degree and scope of practice. One of the top most challenging issues in North Carolina, especially in Durham, North Carolina, is access to quality health care. The issue remains a priority as many North Carolinians struggle to seek health care and maintain a healthy lifestyle. I have been on the front lines in the emergency department working hard to treat patients amidst the COVID-19 pandemic and see firsthand how this has affected the healthcare system I work for and healthcare as a whole. It is no secret that there is a national shortage of physicians and other critical care providers. I've seen firsthand the impact of this national shortage and its impact in North Carolina. A recent North Carolina study estimates a minimum of 14% increase in healthcare services needed in North Carolina by the end of this decade. This calls for action. Access to quality healthcare not only carries a human cost, it carries an economic cost to areas of the state that continue to struggle in mixed economic recovery. This strongly impacts Durham. North Carolina lawmakers, like you, Senator Murdoch, have the opportunity to lessen the impact of the provider shortages without compromising the quality of healthcare by adjusting regulations impacting many care providers. The SAVE Act will allow for advanced practice registered nurses to fully utilize their training to alleviate the imminent crisis while helping to keep healthcare costs under control. Nurse practitioners have the training and capability to combat the shortage and aren't being afforded the opportunity to do so. I believe that giving patients more choices will help to strengthen the overall quality of healthcare in North Carolina. I strongly feel that lawmakers like you, Senator Murdoch, need to focus on a patient access system that ensures quality care with proper oversight. A provider-based approach leads to increased regulatory control and additional costs to patients and the added expense of patient access. Other states like Washington and Oregon, have lessened the regulatory burden on advanced practice RNs as a way to help meet the demand for increased care without showing any compromise in the quality of patient care. None of those states have rescinded similar laws after they were enacted. I believe we can use those states as an example to change the laws in North Carolina. A 2015 North Carolina study conducted by the Center for Public Policy and Inequalities Research at Duke University here in Durham concluded that through modernization of North Carolina regulations, advanced practice RNs would increase by over 24% by the end of 2019. This modernization of regulations would add to new economic and job growth across our state. Legislation like the SAVE Act would lead to an annual healthcare savings between $433 million and $4.3 billion in North Carolina. I would rather grant our talented, deserving advanced practice RNs the autonomy they work so hard to achieve than to lose them to other states. Lack of access to qualified healthcare professionals means lack of quality of care. Not being able to see a healthcare provider when needed is the worst possible healthcare delivery system. Think about it.